Perfect. She moved really easy up here. Good. Very good. Okay, got Jennifer in the office. We're gonna adjust her full spine. Adjust her what was bothering her. Say it again, Jennifer.
L5S1 spinal fusion.
That was the surgery she had. That was how long ago?
A year ago.
A year ago she had spinal fusion. So I actually get this question a lot. I'm glad we did this. A lot of people ask me, can they get adjusted after spinal surgery? And the answer is absolutely yes. Now with her, with this fusion, we can adjust, we can do everything we normally do. That's not gonna hurt this at all. Even when there's plates and screws in there, we can go around it if we need to. But you definitely and absolutely would want to get adjusted after spinal surgery to prevent further damage to the other areas, because as we know, her L5S1's fused. That's going to put more stress above it on the L4, L5 joint, on the sacrum, on the SI joint. So the areas around her spinal fusion are going to have increased demand and stress. So working on those areas, making sure they're in good alignment, making sure there's no stress on the muscles and no adhesions build up in the ligaments around that area would be very beneficial for her, and that's what we're doing. But also, what was bothering you? Neck, shoulders?
Neck, shoulders, and upper back.
Upper back. Yeah, so a little bit of everything, okay? So we're gonna do the muscle work around her surgery first, and then we're gonna do some muscle work on her shoulders and then adjust her. So just basic trigger point therapy, working on the QL muscles that attach way up here in the upper lumbar spine and run down attached to her iliums. We spend time with patients. I do, all our offices do for that matter, doing extra soft tissue work, so you're not just getting boom, 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 adjusted and you're out. We're gonna take an extra few minutes each visit and work on the soft tissue. It's gonna do a couple things. It's gonna help her hold her adjustment longer. It's gonna give her better results, because we're gonna be flushing out and breaking up adhesions and scar tissue that build up in the soft tissue, not just adjusting the joints. Although I will say adjusting the joints is the main thing that we do, and it's gonna give you the most impact. Deep breath in for me. Exhale. She moved really easy up here. Good. Very good. That's just her thoracic spine adjustment. Just something as simple as that. Anybody with pain between their shoulder blades. A lot of headaches and neck pain that we see in the office is originating from down through here, because these muscles run up into your neck, and we're all on our phones too much. We're all on our screens, our computers, and our heads forward, and it just creates a lot of stress build up through here. And again, when you can do nothing and leave these things go. It takes up for the pain. Your pain may come and go, but over time, under the surface, a lot of damage is happening. A lot of scar tissue is building up. And eventually you're going to run into a situation where you're going to, have to face that, all that wear and tear buildup. Without question, the thing to do is to be preventative, to be proactive, to get ahead of those things. Just like you maintenance your teeth and you try to, eat healthy, exercise, or stay active. You got to keep on your spine, keep your spine adjusted, keep it in good alignment, so you don't run into bigger problems down the road. Okay, a little drop work on Jen here. It's our drop table. It sounds loud, but it's a nice, easy. On your side, face me. Nice, easy way to adjust the spine without having to twist, which we're going to do now. And again, she tolerates this just fine, even with the surgery. There's her SI joint, but we're going to correct the areas around it. Okay. You okay?
Yep.
Easy like neck adjustment here. Perfect, Jennifer. Same thing this way. Perfect. And we're just going to do one more in the mid-back, even though she moves really well. We're just going to adjust her between her shoulder blades, higher up here. Deep breath. Exhale. Good. Perfect. Okay. So that's her full spine adjustment for her low back pain, her neck pain, her shoulder pain. Something simple as that, a 5 or 10 minute visit goes a long way in correcting those issues. Thank you.